At 5:30, a follow-up to an I-Team investigation into what nurses at Brigham and Women say is unsafe staffing at the hospital. Last month, we told you how nurses demanded the facility hire more staff, and the hospital says it's done just that. But healthcare providers claim things have not improved. Thanks for staying with us. I'm Paula Eben.
And I'm Fiandaca. Well, now the nurses are planning to hit the picket line. WBZ Chief Investigator Cheryl Fiandaca dug into their concerns.
Nurses at Brigham and Women's Hospital are sounding the alarm on patient care and hitting the picket line Wednesday.
We don't have enough staff to care for the patients.
Those concerns raised in more than 500 reports nurses filed in 2022, claiming patient safety was jeopardized because of staffing. The complaints obtained by the I-Team claim on one day in October, the emergency department was short 5 nurses. On another day in July, a unit was down 6 RNs. And last June, a floor that should have had 20 nurses only had 16.
And that's why we filed the unsafe staffing, because that does help keep them accountable to the state. The good thing about it for the nurse is that it helps protect their license, because they're saying, look, here's the warning to management. We are unsafe right now, so we shouldn't be running as the floor with the staff that we have.
A hospital spokesperson tells the I-Team, like other healthcare organizations, it is experiencing staffing challenges, and in a statement said, delivering safe, high-quality care is our highest priority. We investigate every staffing concern form and provide a follow-up report to the nurse with the actions that were taken if warranted. The statement went on to say, our nursing vacancy is lower than the national average, and we've added 550 nurses to our staff over the last year. Nurses admit more staff has been added, but say with post-pandemic fatigue, many are leaving the profession in droves. Why are the nurses leaving?
Because of the stress level in the hospital. You worked really hard for your license. You don't want to put yourself in a dangerous situation that license could be taken away. We need more nurses.
Mass Nurses Association calls Wednesday's protest outside the hospital an informational picket to shine a light on their concerns. It's not related to contract negotiations since nurses signed a new agreement with the hospital last year. Cheryl, Fiandaca, WBZ News.
And hey, do you have something you think the I-Team should look into? We want to hear from you. All you got to do is send us an email at iteam@cbsboston.com.